This conference will now be recorded.
So welcome everyone to the QMT training for CureGN. Just a couple of housekeeping items before we get started. These trainings is being recorded. And if you're not speaking, please mute your phone. The recording will be available on Basecamp. And if you want to ask a question, but you don't want to speak up, you can use the chat function that can be found usually at the right side of your screen or at the bottom. Okay. So the agenda we're going to go through is what is the QMT, navigating the QMT, and then the types of queries in the QMT. And then we're also going to have a GNLink demonstration. And then an opportunity for questions and answers. The presenters today we have from the DCC is Mike Arbit, who is a programmer from Arbor Research, and he is going to be doing the link demonstration. And then myself, Melissa Sexton, who is the clinical research associate here at Arbor Research, and I will be going through all the other information. So what is the QMT? The QMT is the query management tool, and it's accessible in Link. And I know now everybody does have access to the real-time queries that are in there, and that's what the Glow query tool item is here. So it helps you identify the data discrepancies quickly and provides hyperlinks to the form, the question needing attention. And then the quarterly queries are now going to be available in GNLink, so no more spreadsheets for you guys to complete and return, with two exceptions. The biosample and the pathology queries are still going to be sent in spreadsheets. So navigating the QMT. So to view it, you want to click on the query tool link that's on the far right top black bar. The query management tool opens a temporary window that displays over the top of the page in GNLink. On this page, we have the total unresolved, which is the number of queries not resolved. If queries are resolved, the number will go down. And then we have the X at the red at the top corner. You can click on that or click on Query Tool tab again, and that will close the display window. We also have some filtering options. And these options here are very similar to what's in all the other tables that are located in GNLink. So at the very top of the column, the white box, you can actually put in there what you want to look at. So you can filter that out. And then you also have the reset, filter, and sort. And then we also have the sorting options, which the top row of every table, you can click on the title and it will sort it out for you in alphabetical order, or you could click it a second time and it'll do it in reverse order. The table options, where you can expand or collapse them all. And then the exporting and print options. So if you wanted to export this to Excel, or if you wanted to print it out, you have those two options. They're not required though, but they are there for you if you want them. And then we have the reload, which this updates the manual queries and removes resolved queries from the list. And we'll go into more detail in that a little bit later. So this also will tell you where to find the queries, for which subject, the protocol that it's in, the event, the CRF, as well as the page. And we have the questions, and if you click the link, it'll take you directly to the query. This is one advantage to having it in Link opposed to having it on the paper form, as you can click and it will take you right there. You don't have to go searching for it. And then we have the reason for the query. as well as a resolution column. Now this column is just for those that are manually added, and then you'll fill out the drop down, which is either answer has been updated or answer confirmed as correct. If it's, say, you're being queried with something that, because it's a blank, no answer was entered, you can confirm this, like if it wasn't done and you don't have the answer, you can just answer confirmed as correct, because it's correct that you don't have an answer. So there's those two options. And then we have the validation as of. This date here is for manual ones, will be the date that it's uploaded to the QMT. And then the real-time queries, it'll be the date that the query was actually occurred in LINQ. So to explain a little bit more about the types of queries that you're going to find in the QMT, we have the real-time queries, which is what you are seeing now. And these are queries that originated in GNLink. And you would just click the link in the question field to update that field. Once the field is updated, the item will automatically disappear from the list. No comment in the resolution column is necessary. And issues originated in GNLink will automatically resolve once corrected or confirmed. So when you go to the question, and these are just a couple of examples, if it's out of range, you would just mark it as confirmed if you confirmed it correct, or put in the new value and save it, and that will automatically take it off of the QMT. Or you can mark it as not done. That'd be another way to take it off of there. Like I said, these are just a couple of examples of how it could be fixed in LINQ. And a lot of these, as long as you do it as it comes up as you're entering the data, it won't even generate a query, as long as you confirm it right then and there. So then we have manual queries. Now these are the issues raised by the analyst, also known as our quarterly queries. And as I mentioned, there are two options that are available in the resolution column: answer has been updated or answer confirmed is correct. After you update the field or confirm that the field doesn't need to be updating, you would select the correct resolution and then click the reload button at the top right of the query grid to remove the item from the list. We also have interdependent queries. So for validations that involve more than one field, updating values for a single field may resolve multiple queries. Interdependent queries may be displayed by expanding or collapsing the queries with a plus or minus. So you would click the plus to expand it, which this is showing expanded, and then if you clicked it again, it would take it to just one line. But this just shows, like, if you correct it on one, it will more than likely correct the second one as well. Okay, is there any questions so far before we get into the GNLink demonstration? Okay, then Mike, I will go ahead and pass this on to you.
Thanks, Melissa. Let's see if I can share.
Sorry, excuse me. I'm sure from Columbia. I'm sorry to interrupt. My computer wasn't responding well. So I have a question about the manual, like the query generated by analysis. You said there are two resolutions. One is verified as correct. The other one is, the answer has been updated. I remember before we also have other option like, it cannot be resolved. For example, some questions, I'll give you an example, like a patient of us, like she has a child biologically, but she didn't have she wasn't pregnant for that, like she didn't have the pregnancy. She used a surrogate, and then the link keep querying us for filling out the pregnancy form. So we cannot, none of the two options seem to work for that query, because we cannot, we cannot choose answer has been updated or answer confirmed as correct. So do we have other option, like, couldn't be resolved or anything?
So you would actually do that if answer confirmed as correct. And the reason being is because it's saying that there is the query would be telling you that there's no pregnancy form completed, but you're confirming that no, there shouldn't be one there. So that is correct. Yeah.
Okay. Okay. Yeah, sometimes like for medication dosage, the patient doesn't remember and we don't know
Mhm.
what to choose. I don't know if the option that that couldn't be resolved or anything. For a medication, for example, they're taking some kind of vitamin, but they don't know the dosage, and
Right.
we have no yeah. Um, is there any other option available for the resolution, or you think the two is enough?
Yeah, no, because those are the types. So basically, what'll happen is when you're looking at a query, okay, it's either you have to go in and you have to update it because the answer was incorrect, so you wanted to make sure that you updated it to the correct amount. Other than that, you're confirming that nope, that answer that's there is correct. So whether it's blank or it's out of range,
Okay.
you're just confirming that it's correct. Yeah. Mm-hmm.
Okay,
Yeah, it's sort of
understood. Thank you. Sorry.
yeah, those are good examples. It's basically answer confirmed is correct is just a sign that, you're saying, hey, I looked at it. This is how it is. It's good to go.
Thank you for those questions.
Mm-hmm.
Definitely.
Thank you.
Okay. Okay. Now I'll pass it back to you, Mike.
Okay, thanks. Let me share my screen. We can take a look at GNLink and QMT in action. Okay, did that work? Can you see GNLink?
Yes.
Great. Okay. So I'm on the development site just so I can kind of, work with the queries and not actually affect any actual data from real sites. But it should look pretty similar to what you see in your GNLink. So at the top, like
Mike,
Melissa said, yep.
Before I didn't mean to interrupt you, but just to let you guys know, if you're having a little bit of trouble seeing the screen, because I know it can be small sometimes, if you go to the right-hand side of your screen and kind of hover over it, you'll see a plus and minus button, and you can click the plus to make it bigger. Okay, thanks, Mike.
Mm-hmm. Okay. So the development site can be a little finicky sometimes, so reloading the census page, and then I think I'll be able to open the queries. It shouldn't have this problem in the live link, but here we go. Okay. So it's loading now. You can see at the top left, here's the number of unresolved queries, like Melissa said. So the real-time queries will always be at the top of the list. So you can always tell the difference, like Melissa was showing, between you can tell real-time queries because they're the ones where the resolution box is grayed out. You can't click anything there because you don't have to choose a resolution to resolve the query. So these are already loaded. They're already in your sites, in your QMT on your link page. You could start working on now. Maybe you've already done some. I'll just click on one to give an example. I'll choose this one. So it tells me the patient, the subject number, it's in the biosample collection worksheet. The reason for query, the sample kit doesn't match the barcode entered. Actually, I think I'll choose this one because this one's going to ask me to enter a barcode and I don't want to make up a barcode. So I'll just choose this one. The receiving status, I click on the link and it should take me directly to this question that is being queried. And here we go. It highlights it and everything. So I'm just going to choose an answer. Continue to make sure it saves. And then if I reload the query tool, this number has gone down by 1. It was 37, now it's 36. And there used to be 4 here, and now there's only 3 because the one I just fixed is now gone. So the real-time queries automatically update as soon as you enter an answer or fix whatever the problem is. It will immediately disappear from this list of queries. And the validation date will always, I think it's always today's date because Link is constantly updating and checking on these real-time queries. I'm going to scroll down. These are all still, real-time queries. They've got the grayed out resolution. Eventually, okay, so now I've got some where the resolution is not grayed out. So these are manual queries that I loaded about a week ago on the 21st just to do some testing in the development site. I'm going to skip this first section, this ICAS one for a second. I'll come back to them, but I want to get to these. These should look relatively similar to what you've seen in the query spreadsheets that we've been sending out every quarter. As usual, it's got the patient, the CRF, the page, the question, and the reason for query. And of course, a lot of them you'll see is just a missing value. So I'm just going to choose the first one. I could click on it, but the one nice thing to do, because it's nice to be able to have this list of queries remain up while you fix issues, queried issues, queried fields, queried questions. So one thing you can do is, instead of just clicking, you can right click and open in a new tab, and that will allow you to leave this list exactly as it is, so you don't lose your place. You can stay where you are on the list, and it'll open the question in a new tab. So you can see it zoomed right to the question that was being queried. It highlighted it. I'm just going to enter a number here and hit continue to save it. And so that saved the answer. But of course, it didn't do anything with this query. This query is still on the list. Because it's a manual query, I have to tell LINQ the answer has been updated. And once you choose something like that, you can go to the reload button in the upper right corner. And now this number went down again. It was 36, now it's 35. And once it loads, if I scroll back down to where I was, it's no longer there. There was another patient row sitting here, but it's now gone. So that's how manual queries work. You updated it, or you confirm it's correct, and then once you choose the answer, then you can reload and it'll be gone. And you don't have to reload after every single one. You could choose several answers and then reload lots of them all at the same time. Up to you how you want to do it. So those are straightforward missing value questions. Sometimes you'll find reason for queries that are more complicated, that have different text, just as you've seen in the spreadsheet one. Trying to find one here. Here, this is a good one. So here, the reason for query is this question was answered yes, but no records were entered in the corresponding table. If I open this one in a new tab, you can see, right, so since the last visit, has the participant enrolled in a clinical study? If yes, complete clinical study form. So this question was answered yes, but as the reason said, no records were entered in the corresponding CRF in this case, meaning there was no clinical study form created, even though this question was answered yes. So in that case, you'd either, obviously update it to no if there was no clinical study, or complete a clinical study CRF. This is kind of an old query because like I said, I did this a week ago and I've made some updates to the query since then, but this was just the development site. When you see manual queries in your LINQ site, the reason for queries will be even a little bit more specific than even this one is. I tried to be as detailed as possible to explain exactly what went wrong with the query and also how to fix it if it's not immediately obvious. Yeah, so that's, you can see some of the messages are longer, they have more detail, but you'll always be linked directly to, whatever the relevant question is that needs to be fixed, and then you can select the resolution and reload, and it'll be gone. I want to scroll back up to look at, there's sort of three groups of manual queries. The largest group is these ones that, we're looking at that are just like the ones that have been on the spreadsheets every quarter. Queries that come from CanGrow tables within the forms you fill out are sort of their own group. They're separate. I'm not sure if we have any in the development site. They might be at the bottom. No, they're not. I'm not sure if they're here. But anyway, when you look at the manual queries on your site, you'll see the ones that are on a CanGrow page, and it'll say CanGrow in the page column, are sort of separate from the rest of these. And this is because the programming process on the back end works differently for CanGrow tables, so I can't put them all together. So they're in separate groups. So there's a group of, regular queries, regular CRF queries. There will be a group of CanGrow table queries. And then the third group is the one that I skipped over that was at the beginning. And I can find them again. Here we go. So these are the queries that used to come in PDFs that are about sort of the visit dates, visit schedules, if there's multiple visits on the same date, or if visits are out of order, or if a visit is complete but there's incomplete CRF within that visit, things like that will show up in their own group, because those aren't really related to a specific CRF. They're related to visits that we see on the iTask grid. As you can see, that's this whole group. Obviously, the reason for query you see will be actual text, not just this test message that I just put into test in the development site. But it'll have specific, reason why it's being queried and what to do about it. But when you click on these links, opening a new tab again, it won't take you to a CRF question, since there is no CRF question. it will take you to, whenever this loads, it should take you to the iTask page for the patient that is being queried. And because it's the development site, it's taking a while here. There we go. Okay. So it took me to the iTask grid for this patient, and it even highlighted the row that is being queried. So this is just a sample query that I created. There's nothing actually wrong with this one. I was just using it for testing. But let's say there were 2 visits that had the same visit date. We would query that since we shouldn't have more than one visit with the same date. So it would highlight one of the visits, and you'd be able to see the visit date. And then the reason for query text would have something specific here that would say, hey, there's 2 queries, there's 2 visits with the same date. This is one of them, the one that that is linked. The other one is such and such. The other one is follow up 9 to 12 months or whatever. It'll tell you in the reason for query message what the other one is. And so you could look at the date for this one, and you could look up at whatever the other visit was and check the dates and see if one of them is incorrect. So yeah, that's those are the sort of the iTask queries where something might be up with the visit date, and that'll take you to the iTask grid and highlight at least one of the visits. If there's more than one visit that are involved in the query, it'll highlight one of them, and it'll tell you which other one to look at. So that's the general idea. I do want to any questions on all the stuff I just talked about?
I do have a question. I don't know if it's directly for you, but my question would be, are we still getting like emails to let us know about, when queries are due, or how does that work?
Yeah, great question. I think the current plan is that we will reload or refresh the queries in LINQ monthly, but they'll only be due quarterly, as it usually is, and you'll definitely be getting notified when queries are refreshed on the site. But there will definitely be plenty of communication about all that once it's kind of finalized.
Okay, thank you so much.
Sure. I did want to show the filtering too. So you can always, filter if you want to just work on one patient at a time. The queries are generally sorted by patient. You can see subject 134 is all here together. But of course, there's the real-time queries are their own group, and then there's the iTask queries, and then there's the regular queries, and then the CanGrow queries. So there's a couple different groups of queries. So if you wanted to do all queries from all the different groups for a single patient all at once, you could filter to just one patient. I just take one patient 134. Now I've got all of them. I've got the iTask queries. I've got the regular queries. I've got everything. I know one issue that's been brought up before is that the subject ID is the new study ID, and it would, I'm guessing many of you know the patients better by the old version of the study ID. I believe the GNLink developers are aware of this and are looking into whether we can add a column for the old study ID so that it's easier to identify the patients on your end. I don't know if or when that'll be feasible, but in the meantime, Laura brought up a great idea that what I will do is when I create the queries to load into your site, I will include the old format study ID in the reason for query text. I'll just put it at the end of the message, like in parentheses, study ID equals whatever it is. So if you filter to a different specific subject and you're not exactly sure who that subject is, then you could just look over here in the message, and all of the messages for the same subject ID will have the same, old format study ID. So you'll be able to see very quickly what subject it is if that helps you, find the right information that you need for that patient.
And yesterday at the training, someone brought up a tip for what they do currently is go into the census page and actually print it out so that they have the list of the old IDs along with the new IDs and sometimes a name. So that way you know exactly who goes with each one of the current subject IDs. So that would be an option too at this point until we're able to add a column.
Mm-hmm. So I think the last thing is stop sharing unless there's any more questions. What was it?
Copy for them or something. I mean, we can off. I mean, yeah, just.
Okay. Melissa, do you want to show the table then? I can stop sharing and
Yeah.
Okay.
Yep. And I will go ahead and share my screen again. So we do have a manual of procedures for the QMT, and this will get posted to Basecamp along with a recording and a copy of the slides from today. I still have a few more things I just need to tweak on it, but this has most of the information that we went through today. And then we have this table of query definitions. And it'll show you the reason for the query, where will clicking the link take you, how to resolve it, and then the CRF. And then if there's any questions with this reason for the query, if there's more than one, that'll be listed here as well. Like here's an example here, reasons why there's a query. So it's answered yes to this question, but did not answer any specific follow-up questions. So the question answered yes is where it'll take you. And then you need to answer at least one of the corresponding follow-up questions or update the answers to this question. And this falls under the enrollment and follow-up. And then these are the different answers or the different questions. Okay.
Yeah, so hopefully this will help if if you come across a reason for query and you're not sure what exactly to do with it, you can look it up in this table. It's alphabetical by the reason for query, and it'll kind of tell you all the information about it. And so this also functions as sort of a comprehensive list of everything we're querying if you're curious about that.
Yeah, there's this one here, the date before patient birth date or in the future. There's definitely a lot of those. So this is quite a long list, but like Mike said, you can come in here. They are alphabetical according to the question or the reason for query. And so you can find anything that you see in link. You can come here to find out exactly how you want to resolve it and where you can find it. Yeah, missing value, this is like the longest list that we have in here, just because there are so many that we query for missingness. So that takes up most of this table. And then, yep. So there's all kinds in here. So you should be able to find anything. That's it. So there's actually 24 pages to this. Okay. And like I said, I will be posting this on the Basecamp once I finish the final tweaking of it. Okay. So does anybody have any questions about the query management tool or QMT? Okay. Well, if you do have any questions, you can email us at curegn-projectmanagement@arborresearch.org. You can also CC curegn-help at arborresearch.org so that if I'm not available to answer the question, someone at the help desk will be able to help you. And then as always, please copy your PCC lead coordinator so she's aware of the questions that you have. And also include any examples that you have. The more information you can give us, the easier it is for us to find it and help you resolve it. Okay, such as like study ID, the visit CRF, you can give the query type, anything. Okay, are there any other questions? Well, thank you so much for participating in today's training, and you have a wonderful day. Thank you.
Thank you.